earlier on the news, we told you that the World Health Organization has urged African countries to prioritize mental health in emergency response and planning. And so to shed more light on this, we are joined by a mental health expert, Kunle Pelemo. Thank you so much, Kunle Pelemo. It's nice to have you around. So first, let's understand what factors trigger mental crisis that one should actually look out for.
Thank you so much, and happy World Mental Health Day to everyone out there. Yeah, straight to your question, there are several factors, but key factors that speaks to what we experience in Nigeria here. Number one would be
hello, Kunle. Okay, so we'll try as much as possible to reconnect with our guests.
Very, very.
Kunle, can you hear me?
Yes, I can hear you.
Okay, we lost our connection with you for a moment there. So I'm glad to have you back. So can you just continue with your summation?
Okay. So I was talking about a factor, and number one factor that I mentioned was severe stress. When people go through chronic stress, it triggers mental health crises in them. It could be financial stress, emotional stress, physical stress, or different form of abuse can lead to stress. So these can trigger mental health crisis. Then we talk about in issues related to insecurity that could lead to unresolved trauma in people. And we can witness that in some parts of the country where there are issues of banditry, terrorism, and so many other forms of, insecurity. And what about crises such as flooding and, other related crises? All of these things can trigger mental health related crises in every society. So this calls for, great concern in our climate as we are addressing today for us to know, every single factor that can trigger, mental health crisis and how they can be managed.
Just as you said, the World Health Organization says Africa bears the world's heaviest emergency burdens. I mean, pandemics, conflicts, natural disasters, financial, social stress and all. But in truth, can Africans really escape these triggers?
I would say realistically, but not entirely. In the sense that some of these things will live with us. We just have to mitigate the effect, and we just have to also limit the appearance in the society. I mean, for example, poverty cannot be totally eradicated, but we have to try as much as possible. We pull a lot of people out of poverty, thereby offering financial power to a whole lot of people. How about unemployment? So in Africa, we need to take a deliberate effort that starts from governance, that starts from structure that will help people and that will help them stabilize, their mental health and emotional health as well. So we might not get over all of these things in its own entirety, but we can try as much as possible to limit the damage, try as much as possible to create some measures that will mitigate against the effect even in people. And that is why it's important that leadership in this regard must be taken seriously. We have to take a concerted effort in terms of creating policy that are mental health friendly, and then also deploying ways to also implement all those policies.
Okay, so talking about taking measures now, with the integration of mental health and psychosocial support into emergency preparedness and response, as the WHO said, how will that be done, and what solutions will it provide?
Thank you very much. I think this should be taken as part of the core of crisis management, and not just like an afterthought in the society. Just like I mentioned earlier on, imagine in most African countries, the ratio of mental health worker to to mental health patients is alarming. It's around ratio 1 to 100,000, and in places like Nigeria, it's around ratio 3 to 100,000. That's when we talk about workers and patients respectively. So there is a huge gap that needs to be bridged. And there is a lot of investment that also needs to be done in terms of financial investment and then human capacity investment in the mental health sector to see how we scale up in this regard in order to meet the required standard and then provide psychosocial support for people who are in need in that aspect. So, I mean, a lot needs to be done, but when that is done now, I mean, part of it will take out the stigma that is attached to mental health in the society, whereby people who are mentally ill or people who are having mental health related issues can come out in the open and talk about it without any fear of being judged, because this is done as a result of how well people who are in charge, like respondents and then health workers, how they have been able to create sensitization in the public space in this aspect.
Now, you talked about stigmatization. Are there actually major challenges when it comes to embedding, this sort of framework into Africa's mental care service?
Yeah, I think one of the major challenges I will say is there has not been an organized approach to it, and it has to stem from, a private, public and private, parastatal, partnership in terms of the government creating, policies that support mental health, and then the private sector buying into it as well. How healthy is our workspaces? How healthy is our private and then public institutions, our schools? Are there people who are bullied at work? Are there people who are bullied in school? Are there people who are bullied in different, strata of the society, and how do we treat all of these things? So in doing this, there must be an organized approach to it. There must be a well-concerted effort from the government that will trickle down into every part of the society on how all of these issues are addressed altogether.
And I hope this health package would be affordable and accessible, most especially to the victims of mental stress or mental crisis.
Yeah, absolutely. And that's also one important thing that must be said as well. Mental health should be part of the primary healthcare system. Do we have people in those places? And then that also talks about our primary healthcare system. How virile are they in different places that we have them, even though we know that they are not enough, that we need to scale up in that regard. So mental health should be part of the primary healthcare system of the country, and it should be made affordable to people by training as much as possible first aiders who are mental health first aiders in different parts of the society, up to the rural communities. There are areas in Nigeria whereby a lot of people are going through these issues and they don't even know about it, let alone solving that particular issue. So these are some of the areas that I know we need to scale up in order to win the entire battle and create solution in general.
Well, of course, I know that Finland is the happiest country in the world, so I'm hoping that Nigeria or some other African country will be able to take up that top spot anytime in the future, if not now. Thank you so much, Kunle Pelemo, for sharing your thoughts with us on the news.